Today, I've got a seriously heavy hitting guest joining me, Dr. Lee Harris. Now, if you've ever wondered what it's like to scale a dental group to 6 locations, then pivot into executive leadership or one of the largest DSOs, and still have the energy to coach and consult practices around the country, well, Lee's done all of that and more.
You can't expect to keep 100% of your patients. People move, change jobs, change insurance. It costs a lot to get them. It costs more to lose them.
What do you think maybe are some of the most common causes with practices losing patients?
I was at a client's office just last week. I'm watching the doctor. They're loading the anesthetic into the needle, and he's putting it up in the air, and the patient's horrified. I said, you can't do that. When I talk about attrition, it's not just the dentist. Everybody in the staff, every single person has a role to play in keeping patients in the office.
Some of our most successful marketing campaigns have been when the entire staff is involved in one way or another, right?
Absolutely.
Attrition can be, in dental is a silent killer. Wouldn't you agree?
People don't track it. You talk about this all the time. You can't know unless you're tracking it.
Are there systems out there that can help track this stuff versus like maybe just trying to manually do it? Do you think a brand new dentist from scratch needs to think about retention differently somehow than an established dentist?
Oh, there's no doubt about that. The new dentist is just trying to build trust.
Hey, everybody, and welcome back to the No BS Dental Growth Podcast, where we cut through the noise and give you the real strategies, insights, and conversations that help grow your dental practice without the fluff. Today, I've got a seriously heavy-hitting guest joining me, Dr. Lee Harris. Now, if you've ever wondered what it's like to scale a dental group to 6 locations, then pivot into executive leadership for one of the largest DSOs, and still have the energy to coach and consult practices around the country, well, Lee's done all of that and more. He's the founder of Harris Dental Solutions and brings a rare combo of real-world ownership experience, deep managed care knowledge, and a no-nonsense approach to helping practices grow and lead effectively. Whether you're a new practice owner or a seasoned doc stuck in the weeds, as a few of you are, this episode is definitely going to hit home. So we're going to talk about leadership culture, staff accountability. Attrition is going to be a big thing that we talk about. Some red flags even maybe. So buckle in. This is going to be a good one. And, Lee's not just bringing insight. He's bringing action, and he's done it. And, I'm really excited about this. So let's jump in. Dr. Harris, so good to see you again.
Good to see you, Chris. It's been a while.
Yeah, it has. We did a episode, I don't know, a couple of years ago at least, maybe even more.
At least that long. Yeah, it's been too long.
Yeah, the world keeps spinning, huh? Well, anyway, I think, I want to really frame this around, and we talked a little bit before we rolled the cameras about, we talk a lot, and a lot of people, including myself, talk a lot about new patients. How do we attract them? Everything's competitive. How do we compete with corporate dentistry? And I think you're right in the sense that a lot of people don't think about or remember, attrition problems. How do we, we definitely want to open the front doors and get the patients in, but then how do we lock the back doors so they don't leave? So I really want to focus on that today with you because I know you've got a lot of experience in that. I guess I'll start off by, how do you define attrition in a dental office?
I'm glad you asked that because that's what I was going to lead with. So I don't know, not all dental practice systems track this as attrition, so you might have to do some research. But basically, I define attrition as somebody who hasn't visited your office for routine hygiene in 2 years or more. You've lost them. Now, you can't expect to keep 100% of your patients. People move, change jobs, change insurance. So there's bunches of reasons why people move. But people once told me, I said, you can only control what you can control, but it behooves you not to do that. And one of those things is, keeping people in the office so that you don't let them go, from your own mistakes. So we're going to talk a lot about how you keep them so that they don't walk out the back door and you keep them coming in for hygiene and all the care that you want to do. It costs a lot to get them. It costs more to lose them.
Yeah. Yeah, I totally agree with that. So what do you think maybe are some of the most common causes with practices losing patients?
Well, to me, it all starts with the dentist. Most people come to a dental office. They don't want to come. They're all in fear. 70% of all
Right.
patients go to the dental are fear. So the first thing the dentist can do is give a painless injection. If you give an injection that's hard or you flash the needle in front, I was at a client's office just last week, and I'm watching the doctor, and he's there loading the anesthetic into the needle, and he's putting it up in the air, and the patient's horrified. I said, you can't do that. I said, so hide the damn thing,
Yeah.
hide it. Don't let them see it. And then when you're doing it, be gentle, distract the patient, give a painless injection. If you don't, they're walking out the back door. They'll never be back. So that's the first thing. And I kind of talked to dental offices about this. I said, it starts with the dentist. And that's a good segue to talk to your own staff about this. It starts with me. I've got to give that painless injection. I don't want that patient leaving because I didn't do my job. So I think that's the biggest thing from the dentist. And then other things is all around the staff. When I talk about attrition, it's not just the dentist. Everybody in the staff, every single person has a role to play in keeping off patients in the office.
Yeah. Yeah, I totally agree. And that's the same way when we're talking marketing, some of our most successful marketing campaigns have been when the entire staff is involved in one way or another, right? And
Absolutely.
I think a lot of things in the practices are that way, and it also helps you keep your employees because they feel more involved. So,
right.
But anyway, attrition can be, and I think many a times it is, in dental is a silent killer. Wouldn't you agree?
Absolutely. People don't track it. You talk
Right.
about this all the time. You can't know unless you're tracking it. So as I said, some practice management systems will measure it. So they'll measure, I got 70 new patients this month, and then there are 40 patients that I haven't seen in 2 years. Well, 40 over 70 is not a good ratio. If you're one of them, 20% is okay, you're 20, 25%. But if you're getting into the 50s and 60s, that's not good. So where do you start?
Yeah.
So other than the dentist, to me, it starts with that first phone call that you always talk about, that new patient first
Yeah.
phone call. How do you manage that phone call? And that is huge. That is a huge thing. I tell front desk people, they can see you smiling through the phone. If
Yeah.
you're not smiling, they're not feeling it.
Yeah. We
So
used to tell docs to put a mirror in front of the front desk, stations. And if you look at the mirror and you're not smiling and you're on the phone, then something's wrong, right?
absolutely, people can tell if
Yeah.
you're upbeat and cheerful and happy. And the other thing is that dental people in the front office, they're doing their job, but they talk too fast. They need to
Yeah.
slow it down. They know what they're doing. They've done this a million times, but if they talk too fast, they're trying to get through it. The patient feels that they don't want to be rushed. They want to
Yeah.
get stuff out. You need to listen to that patient. So when you're getting on the phone, when you answer it, hey, here's another good tip. Make sure that when you answer the phone, that if you've got 2 or 3 people that answer the phone, they have a consistent greeting. They're saying the same thing every single time so that there's no difference. They're not confused about what dental office they're calling, okay, and who you
Yeah.
are. Introduce yourself.
Yeah.
And go
Yep.
slow. It's important that you go slow.
Yeah, I mean, everybody, learns at a different level, and, hearing is part of learning. And so why even risk going too fast? So I think that, front desk personnel are really busy, and I get that, but I think sometimes they don't realize that they get in such a hurry that, it can be harmful when talking to a brand new patient. So,
Well, and they should be listening primarily rather than talking. They don't,
exactly.
they should be listening to the patient. What does the patient want? What are they looking
Yeah.
for? How can you help
Yeah.
them?
Yep. 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 So you talked about tracking this kind of stuff, and I'm a big believer of what gets tracked gets done, and attrition should be no different. So what do you think? I mean, obviously, other than the obvious stuff, but what are the key metrics to really monitor? Would you say in patient attrition? What's
Well,
I guess if a dentist is watching this right now, like if he's got a spreadsheet in front of him, he or she has a spreadsheet or a piece of paper, what are they tracking exactly?
Okay, so hygiene visits to me is the
Mm,
key.
okay.
Hygiene is always the driver of dental practices. So if you're going to measure something and you want to find out if your patient, then check recalls, check recall visits. When's the last time that person had their teeth cleaned? That to me is the primary measure of attrition, because people
Mm,
when they think about when was the last time I had my teeth cleaned? If it's a 6 month
yeah.
interval, if they've missed 4 cleanings, whoa, that's a problem, right?
Yep. Yep.
You need to reach out much sooner than that, so that you're not losing them. Once they've hit 4, you've lost them. So I think
Yeah.
cleanings is the biggest measure of anything. Exams is secondary, but I think hygiene is the driver.
Yeah. That makes sense. And, what do you think about using, are there systems out there that can help track this stuff versus like maybe just trying to manually do it?
Well, I think your all the PMS systems will track hygiene visits. So there's
Yeah.
some report you can get out of the system, whether they report it as attrition or not. Okay.
Right.
So I know there's a few systems, and I don't want to mention any names. But there are systems that will actually measure and show you a spreadsheet or a dashboard of what your attrition is every month. But you can figure it out yourself. If you can just go run a report of the end of every month as to what are the numbers of people that have not been in my office for the past 2 years for one code, 1110 is all you need to use, the
Yeah.
Profi code. And if they haven't missed 4 of those in 2 years, they haven't had one of those in 2 years, you've lost them. So just how many people is that? If you have 50 new patients and you had 25 people that fall in that category, then your attrition rate is about 50%, which is a little high.
So I would think that, before the 2 years kicks in, that this should be showing up, on some report or something
Oh,
somewhere,
absolutely. So
you know?
if somebody misses a hygiene visit, you're going to be on the phone. You should have somebody working your recall list all the
Okay.
time. The
Yeah.
first thing starts is when they come out from their hygiene visit, you schedule the next one right then. So you
Yeah.
shouldn't wait. You shouldn't say, "Oh, I'll call you," or have them say, "I'll call you, call me." No, you make the appointment right then, so you have it in the books. That way, if they miss the next one after the reminders that you send them, and that's the next thing I wanted to talk about, is you have to communicate with your patients all the time. So you have to send them, text messages. You should send them a birthday message. You should, sometimes even if the dentist is doing procedures, if there's a difficult procedure he was doing, a care call is a nice thing to do. Reach
Right.
out to the patient. So there should be communication between the office and the patient during the 6 month period as well. Don't wait. So the 2 years is the outside limit, but you should have communications ongoing all during the year to keep that patient close to the vest.
Right. So your time frame is if it's hit 2 years, is that when you officially mark them from a active patient to inactive?
Yes, because
Okay.
in my offices, I'm contacting them every if they make an appointment after 6 months, I'm contacting them in 3 weeks in advance to let them know their appointment's coming up. If they had some dental treatment, I'm talking to them about that. If they don't confirm within 3 weeks, I call them in 3 days, and then the day before. And so I'm constantly talking. The people are constantly talking. Your front desk people know those patients, so they should be in constant contact with them. So if after all this contact over 2 years that I haven't been able to get that patient in, I say, I give up, because I've been communicating all this time, and the chance of me the longer it goes, the harder it is. You know that.
Yeah, for sure.
Getting them back in 6 months is easy. A year gets tougher. 18 months difficult. 2 years, after 2 years, forget about it. They're gone. Now,
Yeah.
you may not know why. So
Yeah.
there are reasons that we're trying to go over. The two of which are primary is that we failed to communicate. The dentist did something wrong. There are lots of other things. So let's
Yeah,
talk about some other things that we should do to that might chase people away, okay, or have them
sure.
not come back. One of the big things I find is that sometimes dentists want to get their patients to do all kinds of treatment. And
Yeah,
it's very true that many patients need a whole lot of treatment, but to force it down the patient's throat is not going to be something that's going to make you feel warm and fuzzy to them.
yeah,
So, if there is a long list or long treatment plan of things, I try and tell them focus on the most urgent thing that needs to be done.
right.
You say, yes, you have a bunch of stuff, Mrs. So and so, but let's just focus on this one thing.
Yeah,
Focus on
create
the
a
one thing.
roadmap
Get
almost.
it, yeah, get them. If you can't get them on the road, you'll never get them to the finish line. Let's get them
Right.
on the road first. So if I can get
Yeah,
them to do that one tooth, that one thing that needs to be done, then I have my hygienist talking to them. I have the dentist talking to them. They're in the
yeah,
office. I can get them for the next thing. And it's not so
right,
much having them agree to this whole laundry list or treatment plan that might be thousands of dollars. Let's get them in for one thing. Let them get in there, make an agreement to do the one thing, get the one thing done, and you're on your way. So
yeah,
I try to use the most urgent thing, or what does the patient want? If you're having a trouble getting somebody in and you can't get them in for what you think is the best thing, get them in for what they're looking for to break the ice.
yeah. Totally makes. Do you think a brand new dentist from scratch needs to think about retention differently somehow than a established dentist?
Oh, there's no doubt about that. The new dentist is just trying to build trust. That's a big thing. So they have to be on their best P's and Q's more than a dentist who's been in practice for 7 or 8 years. Uh,
Yeah,
and I don't really, dentists that are new in practice that are just out of school, they don't really get into their own practices these days. They go to the DSOs. They learn their
right,
stripes through working for somebody else. But most of my clients come to me say, well, gee, I bought my first practice. I'm out of school 7 years. I know what I'm doing. I worked for one of those DSOs here and there. I know what's going on. I've seen it work. Now I'm doing it myself. And then they say, oh, they do everything they can. And then they say, gee, I don't know where to go from here. I don't know how to grow anymore. I don't know what to do. And then they reach
right,
out to somebody like me to say, gee, haven't been growing. I kind of went growing up and I was doing well. And then all of a sudden I'm plateauing. I'm not going anywhere. I'm not ramping up the way I want to. How can you help? And, this
right.
is just one of the things that I'll talk to the dentist about is this. And, consultants not only talk to dentists, I work with the staff. I'm like in the office. A consultant that works to you with a workbook and tries to call you once a month,
Yeah,
that's not going to work because the
yeah.
dentist, it's gone in one ear and out the other. As far as implementation of anything is harder than grasping it. You go to school, you learn
Mm,
stuff, but implementing is the hard part.
yeah, totally agree with that for sure. Well, you've covered some tips on, how to make patients feel valued, right? And
Right.
I think that leads to loyalty. What are some other things that practices, whether they're new or existing, what can they do to really make that connection with the patient and make sure they had a great overall experience?
Well, yeah, just being warm and welcoming, being talking pleasantly, minimize the wait times that they have to wait. Patients hate waiting. Okay.
Yeah,
Oh, you mentioned some. You talked to something over the phone. You know, we got a lot of AI out there these days, right?
yeah,
Everything is AI, but humans are better. So
yeah,
I look at it as if I can get a human to do it, and I can get some empathetic soul to touch base with that patient. Uh, it's better than having AI do it. Now,
yeah,
if I've got my one front desk person answering the phone and another one's doing a treatment plan with a patient, and the phone rings, and I can't do three things at one time. If I only have two people, then AI works. Have the AI pick up the phone. The AI message should be nice and upbeat and empathetic, and then say, "I'm going to call back within an hour," and then you have to do it. Okay,
Right.
so yes, AI is good, and especially after hours, but it's good now. And speaking of AI, that's another thing that dentists can do is tout your technology. Patients
Mm-hmm.
want dentists that are staying up with stuff. So tell them about your scanner, show it to them, scan him on their first visit. Oh, he's got a scanner. He's scanning me now. Tell them what you're going to
Yeah.
use the scanner for. It's not only am I looking at your teeth in 2 dimensions, I'm looking at your mouth in 3 dimensions. And I have a
Yeah.
record of your mouth to look versus this time versus next time so we can see how things are different one visit to the next. Tell them about the can. Use lasers. Talk about your technology. If you have a CT scanner, let them know. Introduce when your patients come to the office. Why not give them a tour? Show them
Yeah.
what you got. You want to get that
Mm.
patient to be there for life, so give them a tour of your facility. Show them what things you have.
That's
Because
a great idea.
yeah, no two dentist offices are alike.
Yeah.
None. It's very different. So tell them what you
Yeah.
got. Share with them the technology you have. People like high tech offices, especially the younger generation, and the
Yeah.
older generation say, "Whoa, you can do that. AI can do that." They're blown
Right.
away. So
Yeah.
yeah, talk about that kind of stuff. And but
Yeah.
humans are, if you're doing contact, humans are better.
Yeah, totally agree. I think, and I don't think it's going to go away anytime soon, but I think when we're talking, if you're ordering a pizza or something, I don't care if it's AI, but when I'm, basically ordering healthcare for my family or myself, AI isn't good enough. I want to talk to somebody that's actually has a heartbeat and, knows their stuff, right? I
That's
mean, it's,
right.
it's
Yeah.
different. There's a lot of commodities out there that you can use AI
Right.
for, but,
Yeah,
Uber,
you're
things
right.
like that.
Ordering a pizza is not ordering
Yeah.
dental care. There's a big
No,
difference.
absolutely. Right.
Yeah.
So,
Yeah.
um, doctor, tell me how you work with practices now. What do you do specifically for them?
Well, I help them organize themselves. I help
Okay.
them learn how to talk to patients. I have a KPI dashboard. So you
Mm,
talk about measuring stuff. I measure everything from production to collections to production by provider, by hygienist, to how much dollars they generate per patient. And then we talk about the percentage of revenue. Let's talk a little bit about insurance because we haven't talked about that.
yeah.
Dentists don't know how to manage insurance.
Mm,
Drives me crazy. So, for example, uh, I'm in network with a PPO. By the way, I prefer my providers not be in network, but if you are and you've got a lot of patients from it, uh, great. But we have to learn how to use it. So, first thing is let's say my fee for a crown is $1,500,
okay.
and the PPO fee in network is $1,000. So the first thing you should do is say, Mrs. So and so, you got this great insurance. You've got a $500 discount right off the top. No dentist that I've ever met has said that until I
Hmm,
come in. I said, tell them they already got a $500 discount by coming to you and me being in network. And then you only have to pay 50% of the 1,000. You're getting a $1,500 crown for $500. What does that tell them? First of all, you're being transparent with regard to your fees. That's really
yeah.
important. And number
Hmm,
two, you're showing the value they have with their insurance and making you look good and reducing the mental thing about, oh, it's going to cost me a ton of money. Because that's what they're thinking when they walk in. And oh, I'm going to need a crown. It's going to cost me thousands of dollars. No. So be transparent, be upfront about the costs. And if the 500 is still a problem, provide them some options. There's all kinds of financing out there. So
yeah.
I think that
Yeah.
that so what I do with dentists is I go through every single area from the new patient call through how to mentor staff about how to make an appointment, how to keep that patient, how the dentist works within the office, how to organize their practice. I organize their schedule. Dentists don't know how to organize the schedule. I say we have major treatment, we have minor treatment, we have hygiene. You got to see every one of those hygiene patients. You got to press the flesh. So I help organize a practice. I write policies and procedures, and I mentor the staff and the doctor. So that's what I do in a nutshell. And I do these KPI reports based upon their practice management system every month. So I keep them
Awesome.
abreast of where they're going, where they've been, and where they're going.
That's great. That's incredible. If somebody wanted to reach out to you and get some help, whether it's with attrition or anything else in dentistry, what's the best way to reach out to you?
I got a website, so you can go to
Okay.
my website and see the services that I offer. I have a LinkedIn page, so you can go there, and I have a phone number, so they can reach me on my phone number. You can give it to them, or it's Harris Dental Solutions, 714-293-2195, or Lee Harris on LinkedIn. They can reach me by any of those means.
Okay, we'll make sure to put all of this information into the comments or the description below. So we're going to wrap it up here, but this is just a small little glimpse of what Dr. Harris has to offer in terms of, just one facet of dentistry with attrition. And again, I think it's something that's so incredibly important and something that really I think people just assume that, oh, I've got these patients, they're going to stay with me forever. And it's just not the case. I think healthcare is, one of the most competitive. In fact, I saw a study not long ago that, healthcare loses more customers, if you will, right, per year than a lot of different industries out there. And I think that, it's not the old school, if you build it, they will come and they will stay, right? They may come,
right.
but that doesn't mean they're going to stay.
If they add up all the costs of what they're spending on marketing, whether it be digital marketing or anything else, they've spent all that, and their acquisition cost is $200, $300 a patient. Yep. You better hold on to that patient, because if you just get them in for one cleaning and one exam, you didn't make your money back. So you got to get them over and over and over again and keep them that way. One more thing before I go, I just want to mention hygiene. That your hygienists spend more time with the patient than anybody else in your practice. So your hygienists need to be empathetic. They need to teach oral health. They need to gab it up with the patients, and they need to be their friend and their confidant. And so hygienists, to me, are gold in the office. So the better hygienists you've got, the more connectivity you're going to have with your patients.
Well, I think they're getting paid in gold right now, because that whole market of hygienists is
crazy.
They're worth it.
They're worth it.
I was just talking to a practice today that, it's there's a shortage, obviously, and it's not just in, certain parts, it's everywhere. And
it's
so
everywhere, all over the country. There's a shortage of hygienists. So if you got a good one, keep them, pay them well. They should generate 3 to 5 times what they get paid. So keep that in mind.
Well, I had a dentist tell me just the other day that, I'm losing money on my hygienist when they do cleanings. And I'm like, no, you're not. You may lose a little money on that, but in long term, you got to look at it.
That's correct.
Yeah. Well, anyway. All right. Well, Dr. Harris, we're going to have you back hopefully sooner than a couple years. So I appreciate you coming back.
And, I've got all kinds of topics we can talk about. You pick it next time.
Okay, sounds good to me. But anyway, thanks everybody for watching another episode of the No BS Dental Growth Podcast. Again, my name's Chris Pistorius, your host. If you like what you see, please share it, like it, whatever you got to do on social media. Send a smoke signal. I don't care. But make sure you do those, because then you're notified as soon as we drop a new episode. So once again, we will see you next time.
Thanks, Chris.
Thanks for joining us this week on the Dental Marketing Podcast. Make sure to visit our website, www.kickstartdental.com/podcast, where you can subscribe to the show in iTunes, Spotify, or via RSS, so you'll never miss a show. While you're at it, if you found value in the show, we'd appreciate a rating on iTunes. Or if you'd simply tell a friend about the show, that would help us out too. If you are ready to grow your practice, then you might want to schedule a free strategy session with us. Just go to kickstartdental.com and click the free strategy session button and give us 15 minutes of your time to change your practice forever. Be sure to tune in next week for our next episode. And thanks for listening to the Dental Marketing Podcast by Kickstart Dental Marketing, where dentists go to win online.